Hi, I'm Adeline Desus, and today we will be talking about a patient who is showing signs and symptoms of lumbar radiculopathy. Okay, so a little brush up about radiculopathy. It is also known as pinched nerve that can affect anyone. Um, But the most common age range for these patients would be around 30 to 50 years old. And we get this when our sciatic nerve is pinched or compressed, but also repetitive movements can also cause us radiculopathy, like lifting heavy objects. And this usually happens because, well, our body doesn't really get better with age. So, yeah. Um, Says here it is characterized by pain, numbness, or weakness along spinal nerve roots. And it says here that this condition disrupts daily activities, which we will be talking about later with our patient. And so, yeah, and the most common symptoms of this is pain, like a sharp pain. Okay, so in this study, we will explore the journey of a 36-year-old patient who presents with symptoms indicative of radiculopathy. All right. Mm, okay. So objective. So in here, the objective of this case, we will be talking about a patient, and we will try to talk about radiculopathy. We'll try to understand its cause, how it develops, and its symptoms, and how we manage it, and how do we provide care for patients who have radiculopathy. Okay. So, a little background on our client or our patient. She's a 36-year-old female. She's a mom of two that works at a customer service. She has a husband who works nighttime, and her kids go to school during the day while she goes to work. And her job, it requires her to stand on long periods of time. So yeah, it's a little difficult for her after her accident. So the patient hit another car head on the day after, uh, about 2 months ago, before her first initial visit. And the day after her accident, that is when she felt a sharp pain in her lower back, and that would radiate down to her left leg. And she would feel numbness in her toes. This pain would cause her discomfort at work, sleeping, and also sleeping at night, because at nighttime, when she tries to sleep, lay on her back, like laying supine, she would just feel shots of pain. And the only solution that she had at the time was to sleep on a reclining chair. So that it's not the most comfortable for her, but it's at least it's not aggravating the pain that she has on her lower back. So yeah. So the client's goal for coming to PD, well, is to be pain free, so that she wants to be pain free so that she could do her job without feeling pain all throughout the day. And he also stated about having difficulties doing a long drive. Even an hour drive is kind of difficult for her, because sitting in extended periods of time, that would also aggravate the pain she feels on her back. So yeah. Okay. Examination findings. All right. So the physical therapist performed data collection, and it shows that she is hypermobile. Um, they also performed a single leg raise testing that was negative, because um, she had a limited range for that, but it was because of her back pain, and it didn't actually produce a radiating pain down through her leg. So it's a negative single leg brace test. The physical therapist also believes that the patient's current weight would be contributing contributing to the patient's or back pain and also her bad posture. So yeah. Okay, so okay, clinical hypothesis based on physical therapist examination findings. The physical therapist believes that the exercises focusing on the exercises should be focusing on relieving tension on her lower back, uh, on her lumbar spine, and the surrounding muscles for it, and that could help alleviate the pain, get her back to like standing on the right posture, walking properly. So yeah, and also home exercises will be um given to the patient. All right. Interventions. We have here the treadmill. We have the Swiss ball rollouts. We have the thoracic spine. So the treadmill is just for a warm up for all the exercises that she's gonna do. So she's not gonna go straight into doing the exercises that could be kind of like shocking for her back. So yeah, lateral flexion stretches, strong rotation, seated abdominal bracing with marches, which will activate her core, keep her steady. So yeah, so all these exercises, it's just gonna help her stabilize her spine when sitting, when standing, and then help her rotate spine and overall just maintain her proper posture. So okay, treatment goals. We just went over that, the interventions, and for the technique, she had there was sciatic nerve glides for her. She's doing it seated because right now laying down on her back is gonna be difficult because it aggravates the pain. But hopefully, as she goes through the plan of care, she could be able to do the sciatic nerve glides, laying on the bed and possibly with a bit of traction there. So yeah, which could be much better, but track putting on some traction while she's doing the nerve glide is a bit hard as for now because she's not that great. She still has to manage her pain. So yeah. Okay, so for outcome, there wasn't much to say about the outcome because it's just her sixth visit. She missed a lot of her appointments on the first 2 weeks because she said it was just too painful for her. The back pain was just too much for her to come to the clinic. And there wasn't anyone to drive her there. So that's one thing. She did say that she had a decreased pain because on her initial evaluation it says that she has a 6 out of 10 pain. Now she has 5 out of 10. She said that she's remaining compliant with her own home exercises. She's very optimistic that she knows that the skill therapy treatment, this treatment is gonna help her get rid of the pain, manage her pain at her in her back, and just return to her prior level of function overall. And so yeah, um there's not much of our exercises that we haven't really able to progress anything since she's still reporting that pain, and we don't want to aggravate that. So yeah. Okay, and then next. Okay, so discussion. So yeah, overall, by this time, as it says here, the patient should have decreased pain level, but she did miss a couple of her appointments, and in some cases, um, or like for some patients, sometimes they will be doing great by this time, but she did miss a couple of her exercises. But one thing to know is she's very optimistic about it. What I learned about radiculopathy is that it really does have a great impact on how a person's daily living could be a little harder with activities every day, walking, sitting on long periods, even sleeping where you should be getting some rest. So yeah, so I hope for this patient, as she progresses, she could get better and get rid of that pain. And that's it for today. Thank you so much. And I have my reference over here. That's it. Thank you.